6 months ago, I took office amid the worst recession in half a century. We were losing an average of 700,000 jobs per month, and our financial system was on the verge of collapse. As a result of the actions we took in those first weeks, we've been able to pull our economy back from the brink. We took steps to stabilize our financial institutions and our housing market. And we passed a Recovery Act that has already saved jobs and created new ones, delivered billions in tax relief to families and small businesses, and extended unemployment insurance and health insurance to those who've been laid off. Of course, we still have a long way to go, and the Recovery Act will continue to save and create more jobs over the next 2 years, just like it was designed to do. Even as we rescue this economy from a full-blown crisis, we must rebuild it stronger than before, and health insurance reform is central to that effort. This is not just about the 47 million Americans who don't have any health insurance at all. Reform is about every American who has ever feared that they may lose their coverage if they become too sick, or lose their job, or change their job. It's about every small business that has been forced to lay off employees or cut back on their coverage because it became too expensive. And it's about the fact that the biggest driving force behind our federal deficit is the skyrocketing cost of Medicare and Medicaid. So let me be clear. If we do not control these costs, we will not be able to control our deficit. If we do not reform healthcare, your premiums and out-of-pocket costs will continue to skyrocket. If we don't act, 14,000 Americans will continue to lose their health insurance every single day. These are the consequences of inaction. These are the stakes of the debate that we're having right now. And I realize that with all the charges and criticism that are being thrown around in Washington, a lot of Americans may be wondering, what's in this for me? How does my family stand to benefit from health insurance reform? So tonight I want to answer those questions, because even though Congress is still working through a few key issues, we already have rough agreement on the following areas. First, if you have health insurance, the reform we're proposing will provide you with more security and more stability. It will keep government out of healthcare decisions, giving you the option to keep your insurance if you're happy with it. It will prevent insurance companies from dropping your coverage if you get too sick. It will give you the security of knowing that if you lose your job, if you move, or if you change your job, you'll still be able to have that coverage. It will limit the amount your insurance company can force you to pay for your medical costs out of your own pocket. And it will cover preventive care, like checkups and mammograms that save lives and money. Now, if you don't have health insurance, or you're a small business looking to cover your employees, you'll be able to choose a quality, affordable health plan through a health insurance exchange, a marketplace that promotes choice and competition. And finally, no insurance company will be allowed to deny you coverage because of a pre-existing medical condition. I've also pledged that health insurance reform will not add to our deficit over the next decade, and I mean it. Already, we've estimated that 2/3 of the cost of reform can be paid for by reallocating money that is simply being wasted in federal healthcare programs. While they're currently working through proposals to finance the remaining costs, I continue to insist that health reform not be paid for on the backs of middle-class families. The bill I sign must also slow the growth of healthcare costs in the long run. Our proposals would change incentives so that doctors and nurses are free to give patients the best care, just not the most expensive care. Even though we still have a few issues to work out, what's remarkable at this point is not how far we have left to go, it's how far we've already come. I understand how easy it is for this town to become consumed in the game of politics, to turn every issue into a running tally of who's up and who's down. So let me be clear, this isn't about me. I have great health insurance, and so does every member of Congress. This debate is about the letters I read when I sit in the Oval Office every day, and the stories I hear at town hall meetings. This is about every family, and every business, and every taxpayer who continues to shoulder the burden of a problem that Washington has failed to solve for decades. This debate is not a game for these Americans, and they can't afford to wait any longer for reform. They're counting on us to get this done. They're looking to us for leadership, and we can't let them down. We will pass reform that lowers costs, promotes choice, and provides coverage that every American can count on. And we will do it this year. Thank you.